Welcome everyone. Today we will discuss why early detection of sepsis in a skilled nursing facility is crucial. I'm very sure that every single of you have been faced multiple sepsis cases when you are practicing in a skilled nursing home as the nursing staff. And we want to talk about how important is the role of nursing staff and also talk about evidence-based practices that actually can save the life. Today, we will discuss about this topic. Let's just speak about why this matters. Sepsis is a life-threatening emergency, and every hour counts. Mortality increased by 8% for every hour treatment is delayed. Imagine if you have a patient in your facility, and for every single hours that you are waiting for the next step, waiting for placing an IV, waiting for the labs, and a change of condition happen, is actually mortality increased by 8% for every hour treatment that is going to be delayed. It is important to understand that nursing home populations are a very vulnerable population, and this is why making early recognition and intervention is extremely critical. Up to 80% of sepsis death could be prevented with rapid diagnosis and treatment. Skilled nursing facility residents are going to have the higher number of the sepsis because of the lot of other medical situations that they're facing. This is why it is important, as we discuss, to have the early recognition of this problem. The most important thing is the definition of sepsis. Key features of the sepsis, and the first thing is understanding the SIRS, System of Inflammatory Response System, which we have criteria for that. If we have two criteria, positive, which is temperature, it can be either hypothermia or it can be temperature above a 38 centigrade, or we can have heart rate, which is elevated, or respiratory rate. Or also at the same time, if we have a CBC result and we look at the WBC and is above 12,000, or is a leukopenic, which is less than 4,000, that can be SIRS. SIRS is the early stage of this situation. First, we have SIRS, and then we have sepsis. That what means that, for example, if we have SIRS criteria and we know the area of the body that is infected. For example, somebody can have urine infection plus the SIRS, means that person is septic. If somebody can cough and have SIRS positive, means that person is septic. But the next stage is a septic shock. The septic shock is when we have sepsis, but when we have persistent hypotension despite of giving fluids. It's not that, for example, you're starting the fluids and the patient's hypotension get better. That's not septic shock. Septic shock is when you start the IV fluid and the person is still hypotensive. Now, let me tell you a little bit here. The most important things that you need to understand that white blood cell can be also low in people with sepsis. Like, for example, when you're reviewing the lab, and if you have someone that heart rate is elevated and the white blood cell, for example, come back 3,000, that means you have a SIRS positive. You have two criteria of the SIRS. Or you have a fever and leukopenia. That means you have a SIRS. That means there is a local infection. And if that local infection plus SIRS, then we talk about sepsis. Why is that? Because when you have a local infection, sometimes the white blood cells, they're all going to go to attack the infections on that side. That actually can cause that when you measure the white blood cell, the amount you see in your peripheral blood is actually going to be less. This is why you can have low white blood cell, not necessarily all the time high white blood cell. The other things I want you to pay attention is the temperature. Many older adult population and many people with immunocompromised condition, they can actually have hypothermia as the sign of the sepsis. And this is important to understand that older adults or people on immunosuppression or immunocompromise, they cannot necessarily raise their body temperature, which is a very complex physiology, and I'll be happy to explain to you another time. But even hypothermia can be a sign of the SIRS. Then, when we talk about early sign to watch, these signs often appear before labs confirm the infection. And this is exactly what we talk about: fever or hypothermia, tachycardia, heart rate above 90, tachypnea, which is your respiratory rate above 20, alter mental status. This is very, very important. I'm always reminding the nursing staff that think about if you have a patient like a resident A that you know this person and you saw this person yesterday, but today when you take over your shift, you notice that this person is not the same person that you saw yesterday. Altered mental status can be an early sign of infection. And of course, hypotension or low cardiac output means that because of compromising condition, the perfusion toward the kidney is less, and we have less urine output, and also we have low blood pressure. These are the early signs as a nurse that you need to watch. The most important part is nursing role. And I believe the most important role of the nursing is communication, and communication, especially early communication, and not waiting for the lab. It's absolutely inappropriate to say, oh, I ask for the lab or x-ray and we will wait to see what's going on. No, we have to do a lot of action immediately. For example, start IV fluid immediately and broad spectrum antibiotic within 1 hour will help to improve survival and definitely prevent mortality. The most important thing when we talk about SBAR as a standard communication tool that ensure the clarity and urgency. Let me give you an example. For example, situation. Mrs. Smith has a fever and tachycardia. This is your situation. When you talk about background, you talk about relevant history. You can say Mrs. Smith was treated for pneumonia last week. When you talk about assessment, you talk about meets SIRS criteria. You went to the bedside, you look at the vital sign, you look at the heart rate, you look at the temperature, you look at the respiratory rate, and you say possible sepsis. That's your assessment. And then R is your recommendation. Doctor, I can start IV fluid and antibiotic now. This SBAR, situation, background, assessment, and recommendation, is the most crucial part of your nursing role. This is why it is important to always think about SBAR. Data shows that early warning system reduce mortality by 18%. We know that every hour delay increase mortality risk by 8%. And nurse-driven protocol cut antibiotic administration time by 50%. This is why it is important to early intervention save lives and reduce complication. The most important thing is surviving sepsis campaign. Again, we know the steps are internationally recognized. Nurses play a key role in initiating this bundle. We talk 1 hour bundle. We measure lactate if it's possible. I'm not necessarily saying in nursing home is important to measure the lactate, but it is important if you have ability to ask for a stat lab to also check the lactate level. Definitely obtain the blood culture, administer IV antibiotic, fluid resuscitation, and vasopressor if needed, which probably not the case for nursing home. That means technically, except the vasopressor if needed, I would say definitely running for labs, including CBC and lactate, which most of the time I see this is missing in orders in a nursing home. You can always have a lactate result, even if you're going to have a next day. That can help a lot to understanding about sepsis, the protocol of the treatment, IV antibiotic therapy, but definitely send for a blood culture, urine culture, whatever necessary is. But the most important two key point that in nursing home is administering IV antibiotic and fluid resuscitation. This is what we call surviving sepsis campaign. This is the practical protocol for a skilled nursing home. And this is all about the talking about emphasize the speed and communication. means that you do the first screen for SIRS criteria, notify provider immediately, start IV fluid and antibiotic, send the labs as we discussed CBC, lactate, and culture, and monitor and escalate if needed. This is going to be the workflow for skilled nursing home nurses. You can always look at the Surviving Sepsis Campaign Guideline, which is updated in 2021. And also you can look at the Sepsis Toolkit for a skilled nursing home and evidence from Systemic Review and Nurses Protocol, which can very helpful. And I always encourage the staff to review these resources for the deeper understanding. Thank you so much. It was great to be with you today. And in the next sessions, we will discuss more about assessment of the patients with early sepsis.